Hi, this is Dr. Mary Kathleen Figaro coming to you from the Thyroid Channel. Thanks for joining us. If this is your first time, please know that this is for educational purposes. If you have specific endocrine complaints, please discuss with a local endocrinologist. Today is the third in the series on the treatments for hyperthyroidism. We've thus far discussed radioactive iodine and surgery. Now we're going to discuss methimazole, the pill that you take for hyperthyroidism. So you've been diagnosed with hyperthyroidism, and in concert with your endocrinologist, you've decided that you would like to go the pill route instead of radioactive iodine or surgery. Certainly it is quick, and you tend to get response from methimazole within a week or two of starting to take the pill. So their symptoms of hyperthyroidism are getting better. It's painless, you don't have any surgery scar, and essentially the pill is easy to take. It's once a day, and sometimes you can be given it twice a day, but up to 60 milligrams of the pill can be taken at once. And sometimes you would need a higher dose, but that's the general FDA guidelines on the maximum dose for methimazole. Methimazole comes in 5 milligram and 10 milligram tablets, and those tablets then can be doubled and tripled and then decreased over time. Methimazole is wonderful because it works in two ways. It decreases the conversion to active thyroid hormone in your blood, and secondly, it makes your immune system less active in your thyroid. So your immune system has been tickling your thyroid gland, making the cells make too much thyroid hormone. You take methimazole, and that tends to calm down over time. And that means your symptoms of diarrhea, of palpitations, of high heart rate, of feeling anxious, etc., are getting better. And why would you continue on methimazole? Well, it's a wonderful drug that you can use for an 18 to 24 month period and come off and potentially have normal thyroid function without the aid of any pill. Imagine that. So you can have a treatment that's temporary for a problem that can be temporary. Hyperthyroidism tends to come and go, and if you can ride a wave with methimazole and avoid the symptoms, avoid the complications to your bone and your heart, and then come off of all medications and have your own thyroid manage itself and give you enough thyroid hormone, that would be wonderful. And that's why patients choose to use methimazole for hyperthyroidism instead of radioactive iodine and instead of surgery. In Europe and Asia, methimazole is used much more than radioactive iodine, and the converse is true here, that we tend to use radioactive iodine more than methimazole. But it's a wonderful drug. It's an old drug that we know very well the side effects. The two side effects are to your liver and to your bone marrow, and those can be both checked by labs drawn by your endocrinologist. And rarely methimazole causes a rash, and then you'd have to switch to PTU. Why do we use methimazole almost exclusively and we don't use PTU? Because PTU is much less potent than methimazole, both to control your thyroid level and to control your immunological problem, and you end up having to take many more pills. I've had someone as many as 24 tablets of PTU per day. We use PTU almost exclusively now in the first trimester of pregnancy, since methimazole is associated in early pregnancy with an abnormality in the skull of the infant. So then if you're trying to get pregnant, or if you are in your first trimester of pregnancy, you are switched to PTU, propylthiouracil, and once you're out of the first trimester and the baby has already been developed and it's only growing, then you're put back on methimazole. Methimazole is a wonderful drug, as I said, and it's off patent and old and cheap and easy to use, so you can see how it would be a boon to use for a person who had hyperthyroidism. The other thing is that as you come off of it, as you taper off with labs to see what your thyroid function is, then there's less chance of a side effect because the doses are low. Can you use methimazole for a long term? Yes, you can actually. I have patients who've been on it as long as 8 years. They chose not to do radioactive iodine, they chose not to do surgery, and they'd rather not be on levothyroxine or another thyroid replacement. Instead, they use this to kind of keep their immune system at bay, and it can work that way as well. So, in summary, this is the third treatment for hyperthyroidism. There's radioactive iodine, there's surgery, but there's also methimazole or Tapazole, or rarely PTU for use so that you can get control of your thyroid disease. And if it's a temporary condition, over 18 to 24 months, you come off the tablet and you can enjoy 5 to 10 years with remission without need of any thyroid medication and using your own personal thyroid for your thyroidal needs. This has been wonderful to share with you. I hope this helps you. And if you like this video, please give it a thumbs up. And if you would like to subscribe, please subscribe below. New videos every Friday.